Some of the causes of depression:
1. Losing your job or experiencing money problems. 2. Relationship problems or the end of a relationship, that is, being heartbroken from someone you cherish the most. 3. Being physically or sexually assaulted. 4. Being bullied or abused, including experiencing racism. 5. Death or a loss. Sadness or grief after the death or loss of a loved one, though natural, can increase the risk of depression. 6. Other personal problems. Problems such as social isolation due to other mental illnesses can contribute to the risk of developing clinical depression. 7. Medication. Some medications can cause depression as a side effect, or you could ask your doctor or pharmacist about any side effects. If you think medication is causing your depression, you can talk to your doctor about taking an alternative. This is especially if you're expecting your treatment to last for a long time. 8. Recreational drugs and alcohol. Alcohol and recreational drugs can both contribute to depression. Some of us may use them to make ourselves feel better or distract ourselves, but they can make us feel worse in the long term. 9. Sleep, diet and exercise. Some of us may struggle with sleeping, getting active, or keeping a healthy diet, and if we find these things difficult, it can affect our mood. These things are unlikely to cause depression on their own, but they could make us more vulnerable to it. 10. Age. People who are elderly are at higher risk of depression that can be made worse by other factors, such as living alone and having a lack of social support. 11. Conflict. Depression in someone who has the biological vulnerability to it may result from personal conflicts or disputes with family members or friends. 12. Illness and health issues. Physical illnesses or injuries can have a significant impact on your mental health. 13. Styles of thinking. Those of us who experience certain patterns of thinking may be more likely to develop depression. For example, if we tend to blame ourselves for negative events. 14. Gender. Women are about twice as likely as men to become depressed. No one's sure why. The hormonal changes that women go through at different times of their lives may play a role. 15. Major events. Even good events, such as starting a new job, graduating, or getting married can lead to depression. So can moving, losing a job or income, getting divorced, or retiring. However, the syndrome of clinical depression is never just a normal response to stressful life events. Lastly, those who do may have depression and feel overwhelmed with sadness and loneliness.